What's going on, everyone? Happy Saturday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. And if you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Saturday edition of the Pandemic Update for Saturday, September 9th, 2023. Starting off today, we do have a few news stories to share with you today. Then we're going to go over some data. There's not a lot of news and data today, but there's enough I figured we would go on with an update today. Full disclaimer, you might hear some thunder in the background. There's thunderstorms developing here. Nothing I can do about that. I was going to delay, but if I do that, we may have to wait a really long time. So, let's roll with it. New studies suggest under estimated long COVID cases, and this is something we've known about for a long time. Some people have COVID, and then they think, oh, they're fine, and then something pops up. A lot of people don't want to associate post-COVID illnesses with something that was caused because they had COVID, or we're just not counting them enough. I mean, there's a whole array of different reasons, but the most common thing I see is people get COVID, then they have a new health issue several months down the line, and they never think, oh, maybe it was because I had COVID. No, they don't want to associate with that because they just hate the word COVID, anything about it. They don't believe it. But no, this is actually a real problem, not just in the United States, but around the world. We're really underestimating the number of people that have long COVID, and it's actually affecting the workforce. Believe it or not, it is. It's part of the reason why you see so many help wanted signs. I get it. I'm going to stop right here and say it. Yes, I know. There were help wanted signs and places that need help before COVID. But my point is, it's worse now than it was before COVID. Let's read a little bit from this. It says, some of the symptoms of long COVID include cognitive issues, headaches, insomnia, dizziness, change in smell or taste, and depression or anxiety. As a result of the multitude of long-term symptoms, estimates show that around 15% of unfilled jobs can be attributed to long COVID, and around 25% of workers with long COVID had to reduce their working hours. With an influx of new COVID cases, the potential overall impact of long COVID could be devastating to the workplace. You know, cases continue to happen, so yes, it definitely could be down the line as time goes on. It's only going to get worse. I can't even picture how bad the workforce is going to be 5 years from now. Moving on to this, I saw this earlier. This has to do with COVID hospitalizations over in Italy. Remember back at the beginning of the pandemic, Italy was really an epicenter, and right now, and I'm not comparing it back to that. I'm just saying who remembers of what happened there in the beginning. And right now, Italy, for multiple weeks in a row, is continuing to rise with hospitalizations, much like what we're seeing here in the United States. Always good to show data from countries that we have not taken a look at in a long time, and Italy is one of them. We haven't seen any data from there in a while. Alrighty, this is now out of the UK. UK reports nursing home COVID outbreak involving the BA 2.86 variant. Apparently, there have been 34 confirmed cases of the highly mutated BA 2.86 variant, and 28 were from a single outbreak in a nursing home, an early sign that it can spread in close contact settings. So this is not good to see. And then we come over here to this, and yes, in Missouri, yet again, another high school football event was canceled due to COVID. There's another one I didn't add on here. I tweeted, I believe it was yesterday. There was one up in Michigan. We're just seeing a lot of them. I mean, it's popping up, and there's probably several more that the media hasn't even reported on. Let's take a look at the latest. Air quality data, and we can see here that along the I-95 corridor in the east, it's a little bit unhealthy. It's high humidity. There's a frontal system that's stalled here. Taking a look from Louisiana on up into the upper Midwest and the Great Plains, yes, it's unhealthy there as well. And we still see some unhealthy air quality, some really unhealthy air qualities in a few places out in the West Coast. So this is not good to see. Alrighty, moving on now. Speaking of that 2.86 variant, let's take a look here. It's now 106 total cases around the world. The most being in the United Kingdom at 36, South Africa has 16, Denmark has 12, and the United States has 8. Now coming over here to heat-related illnesses, again, we'd like to take a look at this, and I suspect it'll come up slightly higher on the new update next week, especially in the Mid-Atlantic region. Speaking of climate, I do have another channel where I talk about climate, and that is at Climate Data Report. We've been talking about Lee lately. We didn't get an update yesterday. We may get something later today. Some fresh model data came in today, which is rather interesting. I got another Twitter where I talk about it as well, called at Climate Data Report. So check that out. Walgreens this week we know is at 40.9% positivity. The prior week was 43.6%, and testing was up this week. Now moving on to BioBot. BioBot did update yesterday, and look at this. The overall trajectory continues to be up, although in the south it dropped a little bit. We'll have to watch. They've been making big corrections early in the week, so we'll have to see if they do another one next week. EG.5 is the dominating variant in the United States. FL 1.5.1 is number 2 at 14.5%. And we're still watching the HV.1 variant at 5.1%. And we will have our wastewater update. It's going to probably likely be out tomorrow. You may see it out a little early, but it's coming tomorrow. I'll probably record it this evening, actually, just to save some time. Taking a look here, yes, those orange and red sites, those pesky ones that are really high, they continue to be high. 60 to 79%, there's 322 of them. 80 to 100%, there's 109 of them. Yeah, so that's not good. That means we're still definitely in this big wave, and in some areas, yes, it continues to rise. I think it's safe to say we're not at the peak just yet. COVID-19 admissions around the country are at 17,418. They've been continuing to rise, so we haven't seen them stop rising yet. And you can see a lot of places around the country are still seeing moderate to substantial increases. Now let's take a look at a few of those wastewater sites that show other things, not just COVID. And today, why don't we come down here to New Jersey? We haven't taken a look at New Jersey in a while. Bridgewater, New Jersey. The overall trend is upward. And for COVID, influenza not an issue yet. RSV not detected yet. HMPV not detected yet. Mpox not an issue. And norovirus is stable at this time. It has been dropping ever so slightly. Let's go out west to California. We'll do one more. And looks like we have to refresh this. Let's see. Let's go out west of California. Here we go. And let's see what's going on. How about we just go to Mammoth, California? This is like a rural, actually no, 350,000 population. Most recent update, rising for COVID. Influenza not an issue. RSV not an issue. HMPV not an issue. No Mpox. Looks like they had a big gap in data. And norovirus, wow, norovirus is actually really have dropped low at this time. Alrighty, moving on, taking a look now. Yes, I have to show you this. Philadelphia yesterday, 892 EMS incidents, almost 900. That's not good. Anytime it's over 800 is concerning, and, well, that's really high. And wow, speaking of being high, 17 active incidents right now in Montgomery County, Pennsylvania. That's not good. What's going on out in Chester County? We do see sick person, and then we see EMSST, which means standby. Maybe there's sporting events going on where they need standby, so that's pretty normal. And now take a look at New Jersey. Up to 489 hospitalizations. I suspect they may cross the 500 line next week. 68 out of 70 hospitals reporting. 18 people on a ventilator. In the ICU, we have 47 people in the ICU over in New Jersey. And discharges, take a look at this, 68 people were discharged, so the volume of everything, it is still increasing. So New Jersey, no, you have not peaked yet. We took a look at this yesterday, Los Angeles. Los Angeles is still rising, but the rise in Los Angeles has slowed a little bit, so that's some good news. New York State does not update on Saturdays. Let's just check anyhow. Now, the most recent update was 3,805 new cases, and the most recent hospitalizations in New York State. Stand by, I have to refresh this. There we go. The most recent hospitalization number was 1,395 with 126 people in the ICU. We know Texas this week was higher at 30,000 cases. versus 27,195. Now let's do a little look at some international cases. Then I do have a little message at the end. Got to include some sort of a message. Um, United States, it says here down 43%. That is totally wrong. Russia, cases up 98%. Romania, cases up 43%. Belgium, cases up 26%. And going back to Romania real quickly, their deaths are up big time. 12 versus 4, that's a 200% increase. Ireland, cases are down 4%. Deaths are up 11%. And then coming down here to Switzerland, cases are up 8%. Mako, cases are up 11%. Hong Kong, cases up 40%. Poland, cases up 26%. Deaths, however, are down. And Bulgaria, cases up 24%. India, we haven't reported on India in a while. In other words, remember how we used to start with the India? We haven't done that in a while. Maybe someday we'll go back to that or include India somewhere in the update. Their cases are up 20%. Morocco, cases are up 92%. Alrighty, one final thing for today. I see so many different people get mad when they hear the word COVID and just COVID in general. They're like, oh, not that again. Well, guess what? I have news for you. For the people out there that do not want to hear the word COVID, guess what? COVID's not over. It's running high right now, and it is on the increase. Please stop joking about COVID. It's a serious illness. We started off today about long COVID. New study suggests underestimated cases of long COVID. Long COVID is real, and it's something that is impacting people right now. Second of all, this is something else I'm seeing a lot of. And I shouldn't even have to talk about this, but I do. I'm seeing a lot of people, maybe they're a caregiver for someone who's disabled, mentally challenged, whatever the case may be. Maybe it's an elderly person. I'm seeing a lot of caregivers with their patients unmasked, and then their patients are unmasked too, of course. It's just like, really? You're supposed to be helping them. You're supposed to be taking care of them. And one part of the job is keeping them safe from illness. Please, my friends, if you're a caregiver and you're caring for someone, please mask up. Do it for them. And this just doesn't go for caregivers. I'm seeing, how when you go to the hospital and then you get released from the hospital and then you have the visiting nurses that come out? Well, we've had quite a few people that have been in the hospital this summer on my block, and we've had a few people who have had those visiting nurses come in. And for the life of me, I don't understand this. They're maskless. Please, if you're a visiting nurse going to a house, you have a lot of different houses you stop at, correct? You're given like a route each day. Okay, you're going to visit this patient, and then you're going to that patient. Please, along the way, mask up. It's not that hard to do. It keeps you safe, and more importantly, it keeps the patient safe. You're interacting with people constantly. You don't know if someone was exposed or has asymptomatic spread, or maybe they're currently sick. Please, mask up. This goes for everybody. And to be honest, I'm going to be a little thankful here. I am starting to see an increase in masking in the grocery store. Are you seeing an increase? I was shocked yesterday. I had to go into the grocery store yesterday. I was like, wow, there's a lot of people masking today. I mean, and I don't mean it was just like one or two. No, it was like 30 to 40% all of a sudden. Maybe it was the time of day. It was just a group of people that happened to be there at that time. It was just a combination of people that, are a little more cautious. I don't know, but at the time that I was in, it was about 2 o'clock in the afternoon, not a busy time on a Friday for a grocery store. There were people masked, so I guess that's a good thing. But it's not good enough. We need to see more people masked, and booster shots are coming soon. Don't ask me who's going to be the one who qualifies. I honestly don't have the answer for that. I'll keep looking out. Maybe CDC will come up with who's going to be eligible. Quite frankly, we all know the answer. Everyone should be eligible for the new booster. But once you do get that new booster, if you're overdue for a booster, you have to do something after the booster. You have to continue masking. Or if you haven't masked in a while, now it's time to go back to masking again. The booster is effective, but only if we mask at the same time. Alrighty, guys, that's my little ending message for today since it is a little slow day. I guess I could have added more news stories that I tweeted out. Chose not to. I wanted to get that out there. It's fairly important. So I will see you guys all again tomorrow for the Sunday wastewater update. As of right now, the next pandemic update is slated for Monday. There will not be a pandemic update tomorrow, even if there's a lot of news. Well, then we'll just get to it on Monday. Alrighty, guys, thanks for watching. If you enjoyed these videos, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you know anyone that needs to hear the messages I just said, or see any of the data that we just went through, by all means, share this with them. I will see you all again next time. I'll see you tomorrow for the wastewater update. Until I see you again next time, stay safe, everyone. Have a great Saturday afternoon.